I divide the emergency rescue operations in Wuhan, Hubei into two phases. The first phase focused on providing additional medical resources to treat infected patients when health centers were overwhelmed. In what became the largest peacetime medical rescue mission ever, every province in China sent emergency medical teams to the region. Concurrently, Wuhan leaders repurposed existing hospitals and built temporary field hospitals to accommodate the surge in infected individuals. Moreover, under national guidance, Wuhan transformed large public spaces such as convention centers and stadiums into Fangzang shelter hospitals to quarantine those with mild to moderate symptoms. Contrary to the conventional view emphasizing the importance of grassroots governance, the shock of the lockdown and the surge in infected individuals initially overwhelmed the grassroots governance structure. It wasn't until the middle of February 2020 that community-level actions gained traction, when treatment and quarantine capacities were significantly increased. Chapter 13 focuses on community-level struggles and, as the second phase of the Wuhan campaign, the efforts to enforce enclosed management of residential areas and home confinement of residents. Authorities relied on both sent-down staff of the party-state bureaucracy and the rank-and-file of grassroots governance structures to enforce community-level lockdowns and home confinement and provide essential services. Meanwhile, the rest of society was demobilized because of the community-level lockdowns and home confinement. By the time the Wuhan lockdown was lifted on April 8, 2020, after 76 days, COVID-19 had already been declared a pandemic by the WHO, and the SARS-CoV-2 virus was rapidly spreading across the globe. China's ability to impose and strictly enforce the stringent lockdown in Wuhan, Hubei, and throughout the rest of the country distinguished it from most other nations in terms of party-state dominance and societal compliance. It wasn't until late 2022 and early 2023 that China, weary from the costs and challenges of repeated lockdowns, finally transitioned away from its dynamic zero-COVID strategy and reopened its borders to the rest of the world. Meanwhile, the striking contrast in China's anti-epidemic performance before and after the Wuhan lockdown compels us to investigate and assess the causes of these variations in China's outbreak response, as well as explore their implications for both China's and global public health.